I have several clients right now that have come to me after being dismissed by their doctors because of age. So I have a big group of women right now that I'm seeing. They're 40 to 60s. I have a couple in their 70s and 80s. And a lot of them went to their doctors because they felt off. And their doctors wouldn't even run just simple blood work because they dismissed it to age. And then I also have young women who feel off that get dismissed, but because of their age, because they're too young to be feeling the way they feel. And then I also have a few postpartum moms right now who they go to their doctors 8 months to a year after having a baby, and they don't feel like they are healing properly, and they get dismissed as well. And it's very frustrating for them. And by the time that they come to me, maybe they've also been to a specialist or two. And we always find through the functional testing I run areas that need to be worked on or improved upon that could be contributing to their symptoms. And sometimes I find things that I then have to write a letter, an email, or even call their doctor to be like, hey, I'm finding this on my end. I think it's worth further exploring to rule out X, Y, or Z, especially if it's something that could be more serious that's obviously totally out of my scope. And it's very interesting because we have been kind of sold a lie that as we age, we should feel like crap. And that's not true. Whether you're, as you go through perimenopause, menopause, you can actually have a very more easeful path into that. And as you get older, you don't need to crumble down and feel like crap. We should actually feel well until the day we die. So if you feel like something's off and you're not being listened to, go with your gut and find those answers. Now, some of my clients, when I go back to their doctors, they're very receptive into running further testing or doing certain imaging that's out of my scope. Some others are not, and I will help my clients find new doctors that will listen to them. There are good doctors out there. And there are good doctors that want to work with your whole team, whether it be your nutritionist, your acupuncturist, your Pilates instructor, your physical therapist. You should have everyone work together as a team. So next time someone tells you shouldn't feel a certain way because of your age, you're too young, you're too old, or you're going through a stage of life where it's completely normal, listen to your gut and find the answers.